the podcast where we explore the people, ideas, and innovations shaping the future of ophthalmology and global eye health. Today, we're talking about a technology that challenges the way we traditionally think about retinal laser treatment. Our topic is the Norlase LYNX, and more specifically, the bigger idea behind it. So today, we're going to explore whether a new generation of compact, portable, and digitally connected laser technology can help change the picture. And we have a wonderful guest joining us to help us understand that vision. I'm very pleased to welcome Oliver Hvidt, the co-founder and CEO of Norlase. Oliver, thank you so much for joining us today.
Thank you so much, Hazel. I'm really glad to be here and talk about things that I think we're all passionate about.
Oliver, you look so young. How long have you been how long have you been a CEO?
Oh, I've been a CEO for almost 7 years now.
Wow.
I sort of managed to squeeze my way into this group of very accomplished researchers and industry executives that was behind the founding of Norlase, which was originally a spin-out from a research lab at a university when I was a student myself. So that was how I sort of managed to hitch my wagon to the Norlase train at a young age, and has then been able to take on some really exciting challenges and took over as CEO back in 2019. Yeah.
Now, before we talk about the links, can I ask what was it about technology and the idea behind Norlase that made you believe that it could become something much bigger?
The long answer is that we originally started with research into like high power semiconductor based laser light sources. And the original vision behind the company was we could see that there are actually lots of places where you use relatively large, relatively complex, sensitive laser light sources. And we just wanted to build a great component that could go into each of those application areas. So as part of that startup journey, we actually talked to a lot of the existing manufacturers within many different applications, but especially within medicine and within retinal laser treatments. We could see that there was a good match and some real interest. But the problem we faced was that, at least in our experience, and it's not uncommon, it's the not invented here, I think, syndrome, where these sort of established players, they were interested to the extent that they could get a cheaper component. But from our perspective, this could really change the architecture of the equipment and really make it more useful and maybe help make the treatment more accessible. So that was sort of the major pivot early on for the company, that we shifted away from building a component to building the full medical device around the technology. So that led first to very compact fiberless laser for attaching on the slit lamp, where instead of having a console and a fiber optic cable, just a second, there we go. The entire, go ahead. Maybe it's too long-winded. I can make it more brief as well.
Well, we're excited about technology because we're in the retina field. And as Scott will tell you, most retina specialists want to innovate. They want to be at the forefront of what's new and what can make a meaningful difference in their patients. But we're also in a time frame where in U.S. healthcare, costs are really the main issue, and we're finding that it's difficult to have great service. So reliability, cost, those all factor in. Our reimbursements have dramatically been slashed. But what made me look at Norlase was I love the Keeler as a base indirect, and I've been taking care of babies for 20 years in the ROP setting. And one of the things I found challenging was the weight and the box and moving things around and moving the cord and keeping it off the baby for sterility. And it was just cumbersome. The whole setup was cumbersome. And I was telling Hazel, I go back to 1998 when I was in a level 1 trauma center trying to get a basic indirect to treat babies. And it was so cumbersome. I'd have to get the box from one facility and the indirect from Detroit, wait for it to arrive, go back to the hospital to laser a baby. So when I found Scott moved from one of our other service lasers to Norlase, I thought he wouldn't move unless it was great technology. So I'm always looking at great service, great technology as the first forefront before I'll even look at it. So, we want old school service, but new technology. So when I looked at the Norlase, the first thing that struck me was the cordless headpiece. And I could actually put this in a suitcase, put it in the overhead and go to a remote region. Since most of our projects are in Africa, it was ding, ding. This would be easy to do. Then when I realized they had a pattern laser for treating diabetics, it was a no-brainer. I said, this is going to really take off in global health and in underserved communities. So kudos for you. I'm not sure that when you devised the technology, you were thinking of underserved areas, or maybe you were.
Yeah, that was part of the vision from the beginning, that we could see that this type of equipment today was non-portable, and that in many places treatment accessibility was centralized to people that may not, or to places that may not be accessible to everyone. And actually, very early on, we worked with Orbis and other NGOs. So the laser is now in many remote regions in everywhere from Ethiopia and Rwanda and remote regions of Peru. It's gone to the Easter Islands. So that's like also really part of what gets the whole team out of bed in the morning, is knowing that we've helped bring accessibility to places where it might not otherwise have been.
Well, we're excited about it because we've set up a wet lab with it as part of our simulation center. And I don't know if you're aware, Hogstrite has developed a laser integrated into the ROP simulator. So it's a nice seamless, the docs come and they learn ROP diagnostically and grading, and then they move to the laser modules, which are quite rigorous. And then they move over to the Bionico simulator model with the Norlase, and they learn how to do that. So we're really grateful for the laser you produce. I'll let Hazel take it from there.
Yes, sir. And one word that comes up when we talk about Norlase is portability. And I think that's very interesting concept when we're talking about retinal laser. Traditionally, like Doc had mentioned, we usually think of laser as a piece of equipment that belongs to a particular room, like the Meyer-Schweiker rat that Doc had mentioned early 1950s. And it's pretty scary when you look at it. But when you make that technology more compact and mobile, the question becomes, does the laser have to stay in one place, or can the technology move to where it is needed? Like, for example, myself, I had undergone laser with my retina for a tear, and I had to travel 1.5 hours to see that doctor and have that laser done, and another 1.5 hours to travel back. So when you started Norlase and LYNX, did you think of having this piece portable, or was it part of the plan?
It was. We kind of made the first laser for the slit lamp, and then thought, wait a minute, can we make this even smaller? And the first idea was to have like a clip on in a belt or something, which would still be a little bit more cumbersome. But then we kind of kept working at it and kept chipping away, and every gram counts and every cubic centimeter. And in the end, we managed to get to a form factor that we're really happy with, where the entire laser is built into the headset and the whole system is battery powered. So that was 5 years ago now, and then last year we then managed to further build in the pattern scanning into the same weight and form factor, which was another huge engineering challenge. And that's been really encouraging to see, because the pattern scanning has been known for when delivering laser through the slit lamp for a long time. So it's kind of well established that it can really be advantageous in terms of reducing the treatment time, and being able to bring that like as the first ever device for the indirect, that it's been really great to see that take off and really make a difference out there. So yeah, the portability is an important aspect, and we wouldn't want to do these things if we couldn't maintain that portability and compactness. And and really maybe at a more fundamental level, in my view, ophthalmology is really defined by being, at least like modern ophthalmology and especially retinal care, being reliant on so much different capital equipment, right? That it can really end up dictating how the practice can be run and what you can provide to your patients. So I think at a more fundamental philosophical level, our vision is to try and address that and enable a situation where the practice is run more based on the needs of the doctor and their patients and less based on the equipment that is needed. And we think we've gotten some of the way in our little corner of the map with the laser so far.
I want to emphasize the reliability and the service component, because many docs starting off don't necessarily think about that. But our former indirect laser never moved. It stayed in the same place. And we always worry about residents or visiting docs stepping on the fiber optic cord and smushing it, making it the light pattern or the power not reliable. So not having that fiber optic dangling off the back is really critical. Second component is when our front headpiece just fell off without moving it, we thought it would get fixed relatively quickly. After 2 months of calls and shipping it out, it took 4.5 months to return to us. And most practices can't go 4.5 months. Thankfully, we still had a cryopexy and a navigated laser, but there were some patients that really did need indirect laser. So that really was a push for us. And in your take, if there's a problem with the laser, what's the turnover to repair it?
Well, that's another advantage of the portability, right? That we try everything we can, and usually we are able to right away express ship a loaner out, and in most cases we can have the customer up and running again by the next day.
Wow,
which I think is
that's unheard of.
And it's not like the technology is one aspect, right? But it it really requires the whole organization basically to be set up for that. And you mentioned, I really like that that phrase of we want new technology, but old school sales reps. And I think what you mean by old school sales rep, our word for it is we want patriots, not mercenaries. I think it's very easy, and it's probably something that a lot of companies in our industry suffer from, to think about, what does it take to close the next sale, and then we move on. But really, you need to be disciplined about thinking what does it take for the customer to be successful, and everything else has to flow from there. And so that's from all the way from frontline sales to the engineering to the logistics and customer service.
The customer service is so key because very few people deliver it today. So, for example, on our side, we don't have time to figure out what kind of case goes on the I guess the equivalent of the iPad, the Android. I'm a Apple user, but it works really great. And Scott said, I'll get it for you. So you don't have to fuss trying to match it up, looking at the size. That's rare today. And while it's still an expense, it made us sign on the dotted line right away because it was less stuff I had to do. And that's what I expect of customer service, but it's rare today. And that's a testament to your mission. And when I see everybody of your employees lined up in a hallway smiling at each other, that's a different culture than we see today. So testament to you. One of the other exciting features that's a safety feature that retina docs encounter all the time is we're in the operating room and safety has us say laser on, laser off, and then we have to wait for someone to run over to the laser and hit the start button. And that could be 10 minutes today in in an OR where you have one scrub running around the room who just left the room when you want to do laser because they think you're almost done. So they left to get something for the end of the case. The nice part about audio is we can say laser on, laser off. How many different languages can you do that in?
You're putting me on the spot here because we're sort of continuously adding new ones. I think with the latest software update, we added Mandarin and Portuguese, and I think that brought us to 7 or 8 languages so far.
That's great.
And yeah, I think that's another learning from me in the industry is seeing then how do practices cope with this kind of complex setup with all the equipment. And one way I see is that you have a huge staff. And like sometimes I've gone to practices where there's one doctor that day, and then there's 10 members of staff to kind of keep everything running. And that's another thing that may not be possible everywhere else, and is probably not the most efficient way of doing things. So if we can make the equipment easier to use and sort of empower the user a little bit more on their own, that's, I think, another step in the right direction.
And another positive is I can set settings, presets, I guess you would call them, for lasering a tear, for PRP laser, for different ethnicities, because if African-American patient, I'd have lower settings, lower power settings. So that's a really great feature. So that's also very efficient. We're always trying to be more efficient in the retina space, but the efficiency, the safety, and the portability were 3 highlights that I just wanted to share.
Yeah, and thank you. Yeah, and I think it's something that where we're also just fortunate that we developed the device in a sort of a bit more digital age. So everything is based on a modern software stack where it's easy to do those things, to access the memory, and also actually relatively easy to provide software updates so that we can keep the devices at the cutting edge and provide new features and so on. So yeah, that's another thing that we're happy about.
Is it different wavelengths that you're developing? Do you have any plans for a PDT laser? I'm putting you on the spot.
Of course there are many different situations where different wavelengths will have different advantages and disadvantages. But fundamentally, in our view, green is the sort of wavelength with the broadest application area. So that has been our focus so far, and it's also what is where the technology works best. So that's the sweet spot for us for now, at least. And then of course what we are seeing is that the current products, that's our first step to realizing this vision of saying how can we make equipment that really make a difference for the doctors and the practices, and deliver them in a way that makes a positive difference. And there, I think there are many other types of equipment within advanced optics and laser-based technology that could where we could potentially deliver similar innovation of improving the usability and the portability and so on. So I know that's very vague. I can't go into too many details, but we have things in the pipeline that we're very excited about.
Hazel, do you have a series of rapid fire questions to finish us off?
Me? One question though, before we proceed with the rapid fire questions, sir. To introduce the technology of the center of today's discussion, Norlase LYNX. For someone hearing about LYNX for the first time, how would you describe it in simple terms? What is LYNX and what makes it different from other products?
So in one sentence, it would be that LYNX is the first and only laser indirect ophthalmoscope with pattern delivery. And so what many doctors are familiar with from products like Pascal or our own Echo laser for the slit lamp, you can now for the first time have with the indirect ophthalmoscope. And it's really like I think for a long time it was just assumed that it wouldn't be possible, and therefore it was something that was thought about for the slit lamp delivery. But actually, when you're using the indirect, it arguably makes even more of a difference because we know that it's ergonomically it's not the nicest procedure to be working with the laser indirect. So if we can reduce by say 50% or maybe even more the time that it takes to complete each procedure, that's a big difference. It's also more difficult to place each spot as accurately in the sort of spot-to-spot placement as you would be able to at the slit lamp. So if the system can automatically within milliseconds deliver a whole pattern, or for example a perfect ring around a retinal tear, or a perfect grid with exact spot-to-spot placement, that's actually also a really big difference. And it's really amazing to see some of these before and after pictures of retinas with the manual LIO treatment and pattern LIO treatment. It's very noticeable difference. So that's the headline. And then on top of that, it comes with the laser built into the headset and battery powered, so that you no longer have the fiber optic cable and you're not even tied to a power outlet. So total portability and pattern delivery through an indirect ophthalmoscope.
That's so nice. It's amazing how it has evolved. Like most people would think that when it comes to technology, the bigger it gets, the better the equipment is. But now it becomes the smaller, the more portable, the more adaptable and connectable it is, the better it is. So it's really nice to know more about that.
Yeah, I think it's that's also one thing we try to really focus on. Is I think sometimes in our industry there can be a little bit of a focus on what you could call specsmanship, and like who can come up with a new smart feature to market, or who can like push some arbitrary performance parameters a little bit ahead of the competition. And that leads to this, like, cost gets higher and higher and the equipment gets bigger and bigger. And sometimes, it seems like no one stopped to think, okay, what is it actually at its core that is needed to help the patient in the most efficient way. And so I think that's where we had an advantage of coming mostly as industry outsiders and kind of start from a clean slate and say, if we started from nothing, but with a really great underlying technology, how would we design this equipment today? And I think that's part of what enabled us to like do, I guess it's like a 95% size reduction or something like that. And then a 20x improvement in power efficiency. I think that's also one thing that we're happy about.
One other question, is Wi-Fi necessary? And two, does it give you a laser report that U.S. insurers might mandate?
Yeah, so it's the device is there's a connection wireless with the tablet user interface. That's a secure Bluetooth connection, and that's the only connection to the device. So no need for Wi-Fi or anything like that. And then you can go into the treatment log on the tablet and see for each treatment what spots were delivered, how many, and at which parameters, and which patterns, and so on. So yes.
All right, Hazel, you're going to finish up with the rapid fire, and we'll close
Yes,
out.
Doc.
Thank you, everyone.
So before we wrap up, I'd like to do a rapid fire question, sir. This will just be, I think, just 4 questions and just brief answers, sir. Okay, so let us begin. What word best describes the future of ophthalmology for you?
Time.
And what is the biggest advantage of making a retinal laser portable?
No, I can't say time again. I would say efficiency.
And what is one thing you wish more ophthalmologists knew about LYNX?
That it's available. I think right now that's really what we're working on, awareness and then getting it into the hands of people, because we call it the puppy dog strategy. Once that happens, it's very rare that we see the device again.
And last question, sir, if you could remove one barrier to eye care around the world, what would it be?
Oh, that's a good question. I think eye care globally is in a difficult place because we are the patient burden is growing faster than the number of doctors. So I think that the short answer would be to snap my fingers and have more physicians in the world, which is unfortunately not a possibility. So that's why we all have to work together to find other ways.
True, so true, sir.
I'm going to close by saying thank you. And your company is also one with social impact. And I think you're striving for sustainability with a low carbon footprint. Can you just comment on the social impact of your company?
Yeah. So, what really motivates us to get out of bed in the morning is to when we can see that we've played a role in providing treatment in where it might not otherwise have been accessible. So we've worked with a lot of NGOs, as I mentioned. We also have working closely with a doctor that goes to Ukraine, to the front lines there, where that's something we forget when we see the missiles and all the fighting going on, that there's still a country and there's still a civilian population that needs a medical system that works. And that's a real challenge under those conditions. And that's where, places like that, where I think we can really make a difference. And then fortunately, the technology we work with is also, it requires a lot fewer resources in its manufacturing, in its transport and so on. So that's, another benefit that we like.
Well, I'm seeing our colleagues in Retina who do work in global health, purchasing and taking your device over. I know Dr. Blair in Chicago has been working with Dr. Lusobi in Uganda, and Scott was nice enough to help train her in our wet lab here. So I hopefully that collegiality and working together can continue. So thank you all very much for coming today. We're very grateful.
Thank you,
Thank
sir.
you so much. It's my pleasure. And thank you for all the great work that you do.
Thanks, Scott. Thanks, Oliver.